What are the results so far?
Well, so far we have more or less 40, 45 cases, most of them sigmoid resections and let's say 8 or 9 rectal cases. In one of them there was indeed a small leak. It was a patient with a diverting stoma, so she didn't have clinical problems with that. And it's not sure if the leak was on the stapler itself, because it was also a pouch. It was a J pouch, coloanal anastomosis. Uneventful, and so far we have a good experience with this.
Will these series of operations continue?
I will continue this series. Of course, our series is too small to make big conclusions about it. And of course, this is not the holy grail that will bring the anastomotic leakage rate to 0. Of course, I know that. We have a lot of factors that influence the outcome. First of all, no traction, that's basic. Also, we check the vascularization like we did now with ICG, which is also, I think, important to do. And then this is one of the small steps that might help. But it's logic that if you cross the staple line, it's logic that this is a weak place of the anastomosis. So if you can avoid that, I think you have a small gain in this.
In terms of duration, does it add a lot of extra operation room time?
No, it's not so much. It takes, let's say, 5 minutes to prepare both dog ears and to bring them in, let's say, 5 minutes maximum. So it's not a reason not to do it, of course.
Can this technique be recommended to other centers?
Scientifically, I have no clue to encourage people to do this, but logically, I think it's wise to do it. If you can avoid those crossing of both stapler lines, I think it's a plus to do that. So I would advise to do it, yes.
Will you present this technique on professional events?
Yes, I will do that. There is a European Congress where we have a poster where we can present it, and there is a Belgian colorectal symposium where I will also show this movie and defend the idea.
If people want to learn this technique, can they come to visit and observe?
Of course, everybody is welcome to come and see this technique. I think it's quite obvious when you see it on the movie, on the video. But if you want to see it in real time, then of course everybody's is welcome to see it.
You have done several cases with IntoCare staplers. What are your findings and results?
Well, they're fine. That's why I still continue using them. You have to get familiar with it. There are some differences between this one and the other staplers that are used since many years. But once you get used to those small differences, it's okay. I didn't have any big problems with that. So as far as the outcome is concerned, I have no major problems for sure.
Do you find IntoCare staplers innovative?
Well, the good thing, one will look from the hospital director's point of view, of course, is the reusable battery and the reusable handpiece, so which decreases the price quite impressively, I think, which is a big argument. But not taking that into account, I also think it's easy to have both staplers, the circular and the linear, on the same handpiece, which is in fact logic, but it was so far apparently not possible to do this.
Yes.
So this is a good innovation, I think.
What is your opinion about the IntoCare circular stapler?
What I find really interesting also is the fact that you can go from different sizes stapling?
That's the height of the stapling. Indeed, you can change from green level to blue level. That is, I think, also important. Mostly we use a blue one, but in some cases when the tissue is a little bit too big, too fatty, or not too fatty, but too thick, then we change to green modus.
Okay.
That's indeed a good thing. Not possible, I think, with other staplers, and that's a good innovative point also.